Okay, first we're going to start by auscultating all four quadrants of the stomach. So we're listening for anywhere between 4 and 35 sounds in a whole minute. So we would usually listen for a full minute. Those would be normal active, which is our normal. Next, we're going to be auscultating for any bruise. So we would go eye level to find the aorta. We see that little pulsation right there. Listening for bruise, which we did not hear. And then we're going to go to the right and left for the renals. No renal bruise present. Okay, next we are going to be percussing all four quadrants of the stomach. So we're hearing tympany throughout all four quadrants. For him, we could hear some dullness if there were stool or a mass. We don't hear any of that. Next, I'm going to be doing the liver. So I'm going to start in the right liver quadrant, and I'm going to percuss up until I hear that dullness, which I do there. Then I'm going to mid-clavicular line, I'm going to start up top, go down. Okay, I'm hearing dullness right about there. So that's about 6-7 centimeters, and that's normal. It should be anywhere between 6 and 12. Next, I'm going to be doing the spleen, so if you could turn a little bit on your left side. We're going to be going, again, the costal margin here. Listening for tympany here, which we hear. Okay, and then if you could lay back. Next, we're going to be palpating, so we're going to palpate in all four quadrants, starting light palpation. Making sure he doesn't have any tenderness. And we're going to be doing deep palpation in all four quadrants. Making sure we don't feel any masses. Doesn't have any significant tenderness. Then we're going to be palpating the flanks. So making sure those are not enlarged or have any masses, anything abnormal there, which they do not. Next, we're going to be palpating the liver. Okay, so my left hand's up under here, and we're going to be pushing up in here, making sure we don't feel any enlargement. It feels smooth. Doesn't have any tenderness there. And if you could do it on your left side again, we're going to be trying to palpate the spleen. So we're pushing up in there. It's really hard to feel the spleen, but I'm not feeling any enlargement or anything abnormal there. Okay, so if you lay on your back. Now next we're going to be doing the special test. So we're going to be doing rebound tenderness. So we're going to push down and then release. And if he feels more pain when we release, then that would be positive, but he does not. Next, we're going to do psoas, so he lifts his leg, and we're going to push down with our hand. And if he feels more pain with that, that would be a positive psoas. Then next, 90-degree angle, the obtruder sign, we're going to turn in and out. And if he were to feel any pain there, that would be a positive sign. And then next, we're going to be looking at the aorta, seeing how big it is. So that right there, so we're just feeling the edge of it. So it's about that far, so it's about 2 to 3 centimeters apart, which is normal. Okay, then last thing we're going to do is we're going to be doing the looking for pyelonephritis. We're going to be percussing the kidneys in the back, and it's negative for that.